Hello to our signing members. This is Katie Capps, co-founder and executive director of the Get the Medications Right Institute. I hope that you've all been having a nice start of your fall this year. Today I'll be giving you a quick update on the Institute's activities and work underway as we engage and educate those who pay for care, those who provide care, and those who receive care to ensure that we're getting the medications right. The Institute has been working to advance our mission through advocacy and policy outreach. We are pleased to announce that we have launched our Advocacy Letters and Policy Documents page on the GTMRx website. Advocacy is a core component of the Get the Medications Right Institute's mission, and our policy positions are aimed at acceptance and recognition of the importance of creating a systematic, evidence-based approach to medications and their rational use through CMM in practice. To advance our efforts, comments are submitted to the Centers of Medicare and Medicaid Services, members of Congress, the administration, and other public sector payers, such as OPM. You can go to our website and view these documents as they are updated routinely. Now, in other exciting news, a group of GTMRx workgroup leaders and participants have been published in the Journal of Precision Medicine's latest issue. Their article, Improving Patient Outcomes Through the Integration of Pharmacogenomics Testing into Comprehensive Medication Management Care Models, will be the featured topic of an upcoming panel at the Journal of Precision Medicine's Leadership Series on October 19th. Three of the authors, Anthony Moriali from the VA, Jacques Turgeon of Tabla Rasa Healthcare, and Ghada El Nassar of OneOhm will be featured panelists for the discussion, and I'll serve as the moderator as we talk about the role of pharmacogenomics testing in the clinical setting, shifting from a reactive testing approach toward a preemptive model. And since many clinicians have embraced CMM, the goal of the panel basically is to educate healthcare professionals on the value of precision medicine and pharmacogenomics testing in CMM care models. We'll also explore methods for implementation and reimbursement opportunities and present evidence to support its role in mitigating polypharmacy and optimizing medication regimes, patient outcomes, and cost savings. So join us at this important meeting. Registration is free, and you'll find more information on the Get the Medications Right website. Now, as our members and as leaders of the healthcare field, your opinion on serious issues facing the field today is crucial to the work that we do. We've developed a quick 5-minute survey to gather feedback on issues in healthcare and the pharmaceutical world today and where they're headed. We'd really be grateful if you would fill out the survey. It'll take you about 5 minutes to complete. So if you've not done so already, please go to our website, take the survey by the end of October. We look forward to your input so we can share the results with you and others in the industry. Now, another important announcement is that in September we launched our Physician Advisory Task Force. Our first meeting was held on September 30th. Now, the goal of the Physician Advisory Task Force is to provide leadership guidance and recommendations that will enable broad practice adoption of CMM throughout the continuum of care. That's going to be achieved by physician advisor evaluation, review, and ongoing recommendations of the tools that are being created by the work groups and the work group leaders, as well as advice and counsel to other audiences and other groups throughout the industry. Now, next, I want to give you insight into a new podcast episode through our Voices of Change podcast series, Building Vaccine Confidence in the Medical Neighborhoods co-lead, Dr. Georges Benjamin. He joined us to discuss how we can overcome vaccine hesitancy and implement systems and processes to help navigate us out of this current and future pandemics. As part of the task force, he led the work in identifying key issues and offering guidance designed to build vaccine confidence at the community level. Now, the task force goal was and still is to inform the strategies that will engage teams at the community level to work collaboratively and communicate effectively about vaccination during current and future pandemics by engaging care teams in local communities, coordinating with schools, religious organizations, employers, barbers, hairdressers, YMCAs, and others in the community that are trusted voices within those communities. All at the same time collaborating with local, state, and federal agencies and communicating with those at the community level to ensure an ongoing, effective, efficient, engaged community response. So if you haven't tuned into the podcast, I would encourage you to do so. As many of you know, CMS's CMMI works to test and implement payment models that can support improved patient care and cost savings for the Medicare population and the Medicare program. As we know from recent headlines, it's undergoing fundamental changes. We believe CMMI will play a central role as we continue to work together to develop payment models that allow greater access to team-based care and services that will optimize medication use, while ensuring that these services are financially viable and sustainable. At the Institute, of course, our goal is to convince CMMI to officially incorporate payment for comprehensive medication management services into Medicare. At a recent GTMRx roundtable, CMMI Deputy Director Amy Bassano discussed with our group the role of CMMI and a few of the new payment models, among them primary care first, direct contracting, and community health access and rural transformation model. The Institute is eager to see what emerges in the coming months from CMMI, and we look forward to working with them to identify opportunities to improve patient access to team-based comprehensive medication management services. Read more about this in a recent blog that you'll find on the GTMRx website. I also want to point you to an appeal that we recently made asking you for your continued financial support of the Institute. Not only can individuals join as individual members and funding members, but organizations and institutions are encouraged to support and fund the work, the important work of the Institute. If you've not had a chance to read that blog, please tune in to it. You can visit the website to read more. Now, we are doing a whole series of webinars have been doing them in September, and this will move into October. Later this month, we're going to host the third in the series of webinars focused on primary care and physician practices, called Integrating Clinical Pharmacists into Primary Care. That event occurs on October 20th. In today's primary care practice environment, with the increased demands on physicians' time, increased complexity of medication management problems, and increased performance expectations, primary care physicians can create team-based and patient-centered programs that will have real impact. Collaborating with a clinical pharmacist is a promising way to expand team-based care. And during this webinar, you'll hear from two professionals that will reinforce that view. Clinical pharmacists are among the least understood and most underrated members of the healthcare team, but the duration of their education and clinical training positions them to support patient care management in advanced primary care. In this webinar, Dr. Teichman and Dr. Wan will cover practical ideas for collaboration and offer insight into how clinical pharmacists are expanding the ability of primary care doctors to resolve complex clinical challenges and enhance quality of care for their patients. They will also discuss three things that facilitate this work: collaborative practice agreements, electronic health record capacity, scheduling, and referral management. So if you've not done so already, please register for this event by visiting the GTMRx website. It's free registration, and there will be a recording after the event available. Now, as I mentioned, this is the third part of a 3 learning opportunity session focused on primary care. In September, we hosted a better way to manage medications. Prescription medicine is the most common treatment for medical problems in America, but medications have the power both to heal and harm. Illness and death resulting from the wrong prescriptions, the wrong dose, or skipped doses, or new medication-related issues cost an estimated $528 billion a year. We showcased this in a recent webinar on Wednesday, September 22nd, where Health Partners, Annie Eidecker, talked about their organization's integrated approach to medication management. Health Partners serves more than 1.8 million medical and dental health plan members nationwide. And comprehensive medication management is available as a benefit to all Health Partners members with pharmacy benefits through Health Partners. High-risk candidates at Health Partners are targeted for services, and they utilize Health Partners pharmacy and medical claims information and EHR data through a proprietary algorithm to identify those that have not met clinical goals of therapy. During the webinar, whose recording is posted on the GTMRx website, participants learned about the team-based, patient-centered approach to medication optimization that has proven to be both a cost-saving vehicle as well as a means in which we can enhance quality. Distinguished Fellow Mary Roth McClurg and Annie Eidecker discussed problem of medication non-optimization. They distinguished between the common practice of medication therapy management problems, and they identify the key barriers to wide-scale adoption. If you've not had a chance to tune into this webinar, I encourage you to visit the website. As you know, we have been conducting surveys throughout the year. We did our first Pulse of Pharma survey in the spring with a follow-up consumer survey with Zogby Analytics. We have a forthcoming employer survey conducted by Zogby Analytics. And in this new survey, our study found that 9 out of 10 employers feel that they would benefit from a more innovative way to manage medication therapy problems. The remainder of the findings of this important work will be released after October 20th. As I mentioned, we partnered with Zogby Analytics and surveyed over 300 HR decision makers from companies with over 200 employees. We were surprised by some of the results, and I hope that this will serve as a guide to understanding employers' needs, wants, and challenges as we advocate for a new system of managing medications and disseminate further our employer change kit and toolkit. Now, I want to point out one other important publication. It's a piece in the Journal of American Health and Drugs Benefits, and it was authored by leaders of the Get the Medications Right Institute's work group. And it articulates the value of comprehensive medication management. Unlike medication therapy management, which traditionally focuses on a disease state, CMM provided by a pharmacist working with a patient in a team-based care model takes a holistic approach to developing a medication regime. It's individualized, effective, and safe. The authors of this important article concluded that the benefits of including CMM in the services provided to primary care patients are without debate. They agree that it is time for widespread inclusion of CMM services and healthcare coverage for patients. So visit our website, Tools from Our Experts, to download and read this article. We're most appreciative of Sean McFarland, Marcia Buck, Shannon Finks, Heather Orth, Amanda Brummel, and Dr. Lisa Smith for co-authoring this important article. Now, at this time, I'd like to thank all of the companies that are supporting financially the Get the Medications Right Institute. And I want to include our newest members, the College of Psychiatric and Neurologic Pharmacists, or CPNP, who came on board to help fund the Institute. We continue to grow and expand our reach, and we couldn't do the great work that we are currently doing without over 175 volunteers and work group leaders. We couldn't do this important work without the financial and moral support of our leadership. And with that, I'd like to thank you, our members, for taking time to listen to this Institute update. Until next time, be well.